Thank you, Dr. Reyes. Now, for the fifth presenter, on effectiveness of an isotonic carbohydrate electrolyte sports beverage in preventing bowel preparation, induced hypokalemia, and hyponatremia among patients undergoing colonoscopy, a pilot study. Please welcome Dr. Beverly G. Bayoko.
Good morning. It is with great privilege that I present to you my research entitled Effectiveness of a Carbohydrate Electrolyte Sports Beverage in Preventing Bowel Preparation-Induced Hypokalemia and Hyponatremia among patients undergoing colonoscopy at West Visayas State University Medical Center, a pilot study. Data from the Philippine Cancer Society show that colorectal cancer ranks as the third most common type of cancer, and the incidence increases as the age approaches 50 years in both males and females, thus increasing the demand for colonoscopy. A successful colonoscopy requires thorough bowel cleansing. However, it increases the risk of electrolyte imbalances. Bisacodyl followed by sodium phosphate was the bowel preparation used in our hospital. A decrease in the serum potassium ranging from 0.5 to 0.57 millimole per liter has been documented, and the incidence of hypokalemia ranges from 20 to 30% among ambulatory patients and up to 70.4% among admitted patients. Hyponatremia is also a possible consequence of intravascular volume depletion. Mild hyponatremia was identified as a predictor of morbidity and mortality even in patients who underwent elective procedures and classified as ASO Class 1 or Class 2. Both the American Society of Anesthesiologists and the proponents of the Enhanced Recovery After Surgery program recommend the co-administration of carbohydrate electrolyte solutions for prevention of dehydration and replacement of electrolyte losses. Aside from patients undergoing colonoscopy, this may benefit patients who are taking laxatives for major colonic surgeries as well as gynecologic surgeries. So this study aimed to determine the effectiveness of a carbohydrate electrolyte sports beverage in preventing bowel preparation-induced hypokalemia and hyponatremia among patients undergoing colonoscopy at our institution. Specifically, this was conducted to describe the clinical demographic profile of patients in the two treatment groups: isotonic carbohydrate electrolyte sports beverage and distilled water. Second was to compare the levels of serum sodium and potassium respectively after bowel preparation in the two treatment groups. And lastly, to determine if there is a significant difference in the mean serum sodium and potassium after bowel preparation between the two treatment groups. This was a pilot randomized controlled clinical trial conducted for 6 months among patients from the outpatient department who were scheduled for elective colonoscopy. Patients with normal baseline serum sodium and potassium, those who were 18 to 75 years old, and belonging to ASA Class 1 and 2 were included. And the following were the exclusion criteria. The flat rule of thumb for a pilot study by Kaiser and Wasmer for a 2-arm trial was used. Random sampling was done and the research randomizer was used. This study was approved by the Ethics Review Committee. The bowel preparation used at our hospital was maintained and it was administered a day prior to the procedure. Patients under Group A were instructed to drink 200 ml of the sports beverage hourly starting from 6 p.m. until 9 p.m. and a total of 800 ml was consumed by bedtime, while those belonging to Group B were instructed to take the same volume of distilled water at the same time interval. On the day of colonoscopy, at 5 a.m., the patients in both groups were instructed to take the remaining 200 ml of the assigned beverage. At 7 a.m., blood extraction was done for the repeat serum sodium and potassium. Statistical analysis was performed using EpiInfo 7. So a total of 20 patients were qualified to participate, and overall, 20% belonged to ASA 1 and 80% belonged to ASA 2. 45% were below 60 years old and 55% were 60 years old and above. 70% were males and 30% were females. So this shows the frequency and percentage of patients with increased and decreased values from baseline. There was a mean increase of 3.3 millimoles per liter for sodium in patients given the sports beverage and an increase of 2.51 millimoles per liter for those given distilled water. For serum potassium, the mean increase was 0.36 millimole per liter for those given the sports beverage, while there was a mean decrease of 0.36 millimole per liter for those who were given the distilled water. Among those given the sports beverage, 100% had normal sodium, while for those given distilled water, 10% developed hyponatremia. The mean baseline sodium of the two groups were comparable, with a p-value of 0.531. After bowel preparation, the p-value between the two groups was 0.425, hence the change from baseline sodium in both groups was not statistically significant. This shows that among those given the sports beverage, 10% developed hypokalemia, as low as 3.33 millimoles per liter, versus 40% among those who received distilled water, ranging from 2.96 to 3.42 millimoles per liter. The mean baseline serum potassium between the two groups were comparable, with a p-value of 0.73. After bowel preparation, the difference was statistically significant with a p-value of 0.044. The mean potassium of those given the sports beverage was higher as compared to those given distilled water. Hypokalemia has been reported in as high as 26% to 56% of elderly patients. The results of the study is comparable with the results of previous studies on the incidence of hypokalemia, which occurred in 10% in Group A and 40% in Group B. Furthermore, a study by Florentine et al. Documented a decrease in potassium by 0.5 to 0.57 millimoles per liter, whereas in this study, there was a mean decrease in serum potassium by 0.36 millimole per liter for those given the distilled water. In this study, only one patient developed hyponatremia and was under Group B who were given distilled water. This patient belonged to the age group of above 60 years old, and the patient's age probably was a factor in the development of hyponatremia since elderly patients are at risk for impaired water handling and dysnatremia. Older patients are susceptible to water retention and related electrolyte abnormalities, which may be exacerbated by physiological stress prior to and after a procedure. Sprite was used as part of the bowel preparation regimen in both groups. Sprite contains sodium as the only electrolyte, which can probably explain there was only 10% of patients who developed hyponatremia as compared to 40% who developed hypokalemia